Wake up! It's the Sleep Unplugged podcast with Dr. Chris Winter, episode 35 Sleep and Cardiovascular Health. Stop dragging your heart around. Welcome, everyone, to the newest episode of Sleep Unplugged. My name is Dr. Chris Winter. I'm a neurologist and sleep specialist and your host for the episode. If you're new to the Sleep Unplugged family, and there seem to be a lot of you this week who've joined up and listened to the podcast based upon the numbers, my most sincere welcome to the Sleep Unplugged group. If you're a veteran to the podcast, welcome back. Glad you could be with us. This was a really, really big week for the podcast last week. Episode 34 was on sleeping positions. I was curious to see what the response would be, and it was big. People want to know about the science behind sleeping positions and which is best for what you need out of your sleep. And so that was a lot of fun putting that episode together. I'm glad the response was really high. As always, really look forward to hearing from you about the episodes and what you can do to make changes that can possibly benefit your sleep. If you want to get in touch with the show, it's easy. You can contact me through social media. Dr. Chris Winter Twitter, Dr. Chris Winter Instagram, Dr. Chris Winter TikTok. You can find us on our YouTube channel. We're up to 95 subscribers. We're closing in on 100. So I'm glad people who want to see the podcast are able to find it that way. And actually, the communication we had this week that I'll share in just a moment came from the YouTube page. We appreciate any comments, criticisms, corrections, anything you want to say about the show, we'll put in there and talk about it. I've got 2 books about sleep: The Sleep Solution, Why Your Sleep is Broken and How to Fix It, as well as The Rested Child, Why Your Tired, Wired, or Irritable Child May Have a Sleep Disorder and How to Help. So this is a big topic we're tackling this week: sleep and cardiovascular health. I want to briefly touch upon a communication I got through the YouTube channel from Joyce H. Always appreciate comments through social media. Joyce writes, "It's so refreshing to have someone who is realistic and honest about sleep issues. Thank you. I especially love your realistic approach to insomnia. Makes total sense to me." Well, I appreciate that, Joyce. That's music to my ears. And for those of you who are new to the show, we do an insomnia episode the first Monday or Sunday night, Monday morning of every month. Technically, the podcast comes out midnight Monday. So every week, if it's the first Sunday, Monday of the month, it's an episode on insomnia. And our last one was big. We did an episode about CBTI. That was episode 33. So, Joyce, I'm really glad you like the content. Insomnia is a big, big topic, and I like sort of revisiting it every month in a different angle, and I'm glad that content's working for you. So let's get into the episode. Before we do, let's talk about the topic. Stop Dragging Your Heart Around is, of course, a reference to the 1981 Stevie Nicks, Tom Petty song, Stop Dragging My Heart Around. This song was actually written by Tom Petty and his guitarist. Stevie Nicks had nothing to do with the writing of it. She had joked one time when she met Tom Petty when he was recording Damn the Torpedoes, his album, "I'd love for you to write a song for me." He did write a song. I forget the name of it. I'm blanking on what it was, but she said, "I feel like you like that song so much, you should record it." And he did on a subsequent album. But he felt bad that he did that, so he ended up writing "Stop Dragging My Heart Around" and gave it to her, and she really liked it. The producer of the album was actually Tom Petty's producer, Jimmy Iovine, who's a famous producer, produced U2, all kinds of important people, and they were living together at the time. And when the album was getting put together, the "Stop Dragging My Heart Around" was not necessarily going to be on it. And he basically said to Stevie Nicks, "Look, this is your first solo album." This was the Belladonna album, 1981. "This is your first solo album after leaving Fleetwood Mac. I don't know that you have a hit on this album. You've got to put Stop Dragging My Heart Around on the album. She did. It was her first hit off of the first solo hit, biggest solo hit she's ever had in her career, and really kind of launched things. Interestingly, the second hit she had off of that album was Leather and Lace, which was another duet with Don Henley. It wasn't until Edge of 17, her third single off Belladonna, that she had her own Stevie Nicks written, Stevie Nicks performed song, which is awesome. It's interesting. She and Jimmy um, Iovine were living together, and Dave Stewart brought him the song "Don't Come Around Here No More." And because he had just broken up with Stevie Nicks and they were kind of on the outs, he didn't give it to her and instead gave it to Tom Petty, and he obviously recorded it. It was a big hit for him too. So lots of interesting trivia around a truly fantastic song and probably one of the best duets of all time. And if you haven't seen, I think Jimmy Fallon recreated it, measure by measure on the Tonight Show. It's pretty funny. So let's get into the cardiovascular associations between sleep and the heart. And, when I think about research and data and relationships between sleep and whatever. So you're listening to your favorite podcast and they tell you, taking this vitamin, doing this supplement, breathing through your left nostril, but not your right, will increase your deep sleep. I think of research as sort of on a spectrum. There is stuff we know for sure. And I always use the example: plants use chlorophyll to harness the energy of the sun and carbon dioxide to make energy and sugar for the plant and release water and oxygen into the environment. We know that. So I kind of think about that as being on the far end of the spectrum. And on the far other end of the spectrum is something that we don't know for sure. Could be, maybe breathing out of your left nostril does improve your sleep more than breathing out of your right. We just don't have any great evidence to prove that. And I guess you could go even further in that direction on the spectrum and say things we know that are not true, but we'll leave that for the time being. So I want you to think about the things that we're talking about today as being pretty close to the chlorophyll side of that spectrum. These are things we really know to believe to be true. And what's interesting about the relationship between sleep and cardiovascular health is back in 2010, the American Heart Association said, we're going to come out with things that you can change to influence your own cardiovascular health. And in 2010, the American Heart Association came out with Life's Simple 7, which is another name for the dwarves in Snow White, perhaps. But the Life's Simple 7 said nothing about sleep. And so recently, this was changed, and the American Heart Association said, we're going to change this to the Essential 8. And the Essential 8 was essentially Life's Simple 7 with sleep involved. So what constitutes the Essential 8 that we talk about now? It's diet and eating better, exercise, being more active, quitting tobacco, which is a huge risk factor for cardiovascular disease and cancer if you didn't already know that, managing your weight and keeping your weight at a healthy place. And we've mentioned on the show earlier that the American Academy of Pediatrics just came out with some much more aggressive measures talking about weight in young people. And if you want more information about that, there's a fantastic daily about that not too long ago. Controlling cholesterol and being aware of your lipids, managing your blood sugar, and you're treating diabetes if you have it, but also just managing blood sugar abnormalities, and then managing and controlling blood pressure. So that was the 7, and now they've added 8, because what the American Heart Association is basically saying is, look, the relationships between sleep and cardiovascular health are all over the place. In fact, if you look at the 7, the simple 7, sleep impacts all of those things. We know that sleep impacts individuals' tobacco use. We know sleep makes individuals make poor choices with eating and affects metabolism. Sleep interferes with the ability to maintain proper weight. Sleep interferes with inflammation and cholesterol management, which we'll talk about, blood sugar, blood pressure. So all of these things that we're talking about in terms of Life Simple 7 are being independently influenced by sleep. I mean, sleep's huge. I, I'd want to say hello to the FBI. I just did a lecture up at Quantico this past week and was given 3.5 hours to do it. And even with that kind of time, I often feel like there's still so much you want to do. And I'm doing a lecture at another organization this upcoming week where I've been given 1 hour. And it was interesting because I was looking at the other topics that day, and one was sort of communication styles. Okay, well, I think leadership needs to be aware of that. Another one was sort of interpersonal management or something like that. Okay, well, that's important too. And then in between this 3 hour lecture on interpersonal styles and 4 hour lecture on communication was my 1 hour sleep lecture, which hey, I'll take one over none. But if you're in any kind of management situation, healthcare situation, fitness situation, those other things are extremely important, very important. But when you start comparing them to sleep, something that's fundamental, we can't live without water, air, food, or sleep. And the way sleep interferes with all of these things is just incredible. And that's what we're going to get into today and really discuss, which I'm really excited about. So let's start off with a little bit of historical context. I found a fantastic article from, let's see here, where was it? Yeah, April of 1946. It was Wiener Mediziner Wochenschrift, which is a German journal that looks like it's still in print. That's the Vienna Medical Weekly. And so back in 1946, there was an article entitled, "Is there an influence on the coronary vessels in the event of a lack of sleep?" So even back in 1946, and probably well before that, there was communications about, hey, I wonder if sleep is influencing some of these things that we're discovering about the cardiovascular system and the heart. And sure enough, there is. And I'm going to touch upon just a few little pieces of research with each of these topics so we can keep this relatively short. In 2019, there was a study looking at individuals and sleep. It came from Emory, which is where I did my medical school training and worked in their lab with Don Blauetz and David Rye. And their study showed that 39% of patients with coronary artery disease. So when we talk about coronary artery disease, what we're talking about is the arteries that are supplying the heart. These are the arteries that get congested or clogged or blocked when somebody has a heart attack. So this is a little bit different than the systemic vasculature. So like the vessels that are bringing blood to and away from my hand are, the heart is pumping that blood through my cardiovascular system, but the cardiovascular system in the heart is actually pumping blood to those specific coronary vessels that supply itself. So in the heart is essentially feeding everybody, including itself, so it can do its function. So individuals who are sleeping fewer than 6.5 hours had 39% more, had 39% of those patients had coronary artery disease who were sleeping less than 6.5 hours. I'm going to restate that for clarity. Of the individuals with coronary artery disease, 39% of them were sleeping fewer than 6.5 hours. 35% of them were sleeping longer than 7.5. So essentially, 75% of the individuals in this study who had coronary artery disease, the 3/4, are on the opposite ends of sleep, getting too little and getting too much. We often refer to that as the J curve. So if you think of sort of a J shape, there's high risk on the one end of the J and really high risk on the other. And that's how we think about getting too much and too little sleep. And we've talked about how difficult those studies are to sort of control. But keeping sleep in that sort of consistent normal range at or about 8 hours for the average individual is extremely important. So let's move on from coronary artery disease to atherosclerosis in general. So now we're talking about the building up of atherosclerotic plaque anywhere in the cardiovascular system, in the carotid arteries, in the femoral arteries, any artery, even the arteries that supply the brain. We want to think about. So in 2019, there was a study in the American College of Cardiology that looked at 3,974 men and showed that those who were getting less than 6 hours of sleep routinely had a significantly higher burden of atherosclerotic plaque. So when you're thinking about sleep, both in terms of inadequate and too much, it is having a meaningful and significant consequence to the arteries of your heart, but also the arteries throughout your body. We often refer to that as peripheral vascular disease. And we know that when you start blocking arteries, bad things happen. Heart attacks happen, as we mentioned before, but also strokes. So the relationship between the cardiovascular outcome of a stroke, which is essentially a part of your brain stops getting oxygen. Now that can happen because the blood vessel that is supplying it is ruptured and you're bleeding. So when somebody has a dissection or an aneurysm rupture, the reason for the stroke is you're not getting the supply of blood that you need. You can also have a stroke because the blood vessel is fine, it's just clogged. So now the oxygen-rich blood cannot reach the brain because there's something preventing it. And then you could also have a stroke where you don't have enough oxygen in the blood, like an asphyxiation. So this is looking at individuals who are depriving themselves of sleep, have sleep apnea, or other sleep disorders, all seem to increase the risk of both stroke and heart attack by twofold. So when we're looking at risk factors for heart attack and stroke, sleep's a big one. And it's really interesting, when I was a resident in the hospital, there was definitely a time for stroke, meaning that a lot of strokes seem to come in the early morning when the individual first woke up. And that's a time of pretty dramatic cardiodynamic and hemodynamic change. You're going from sleeping to suddenly awake. Alarm clock goes off and you pop out, and now you relax, and now you're stressed because you got to go to work. And that was a time when a lot of people came in for stroke. So we know there's relationships between sleep and stroke. In fact, that was something I studied when I was at Emory, looking at how sleep fragmentation of any kind affected the blood flow through the brain. And it really did, especially fragmented nights. So when we think about cardiovascular risk, let's switch gears and think about blood pressure. If you ask anybody, what's the biggest risk factor for, having a bad cardiovascular outcome, I bet most people would say it's, high blood pressure, not managing high blood pressure. 2019 study out of Current Hypertension Report showed that studies linking short sleep were associated with hypertension risk. Reduced nocturnal dipping. So when we talk about dipping, non-dippers, people whose blood pressure does not appropriately drop when they're sleeping. And a lot of people are aware of these things now because of monitors that you're wearing. So some of the more advanced sleep tech can tell, is your blood pressure dropping appropriately? This kind of gets into sort of heart rate variability, which we've talked about before, and we'll do an episode on sleep tech at some point. And then also elevated morning blood pressures. So, and that kind of goes along again with the non-dipping. You go to bed, your blood pressure should drop when you wake up. You should get the benefits of that sort of lower blood pressure during the night. But individuals who are not getting enough sleep sort of start the day off at a higher blood pressure, theoretically, because they didn't dip. And what's been shown is that when you experimentally restrict sleep or experimentally extend sleep, that seems to have a positive impact on blood pressure. And one of the things that's really been coming out of the literature more recently is that these types of problems may preferentially affect women and individuals of ethnic minorities more than white men that often populate some of these studies. So this is something that has been extremely of extreme interest to the cardiovascular and sleep community is, how do we make sense of all this information and data? So building up plaque in your heart, building up plaque in your body, elevating your blood pressure, increasing risk of stroke and of heart attack. Another thing that's an independent risk in terms of cardiovascular health is arrhythmia. So arrhythmia is essentially your heart is beating in a particular rhythm that is regular. If you put your fingers right here on your carotid artery, you can feel your pulse, or on your wrist, you can feel your pulse. Lub dub, lub dub, lub dub, lub dub. It's predictable. You can tap your feet. You can do it, kind of get the rhythm of your heart rate and tap your feet. You probably take your fingers away for it, keep tapping your feet, and you come back. It's probably right on that rhythm. It's predictable. It's regular. Should be anyway. If it's not, if you're listening and feeling your pulse and you're like, this is the worst beat ever, like I can't figure out what the rhythm is, you could be in some sort of arrhythmia and you should talk to your doctor immediately. It can be a medical emergency. Some people have no idea that they're in arrhythmias. Other people do. And the most common one that we see is atrial fibrillation, but there's lots of them. If you've ever taken that cardiovascular class where you're your cardiovascular life-saving class or whatever, you got to recognize different rhythms and know when to shock and when not to shock. This really helps. And most of the AEDs in terms of shocking that are automatic figure all this stuff out for you, which is probably important. So in 2022, there was an article in circulation called Sleep Disordered Breathing, so like sleep apnea, we've talked about that before, and cardiac arrhythmias in adults, mechanistic insights and clinical implications, a scientific statement from the American Heart Association. And if you look at that paper, among all the authors, there is Susan Redline, who is a beast within the field of sleep. And whenever you see her name attached to something, or she makes a proclamation about something related to sleep in the heart, I would suggest that you pay attention, because she is a heavyweight in the field of sleep and cardiovascular health. So this consensus of this paper was that the interplay of sleep disordered breathing, sleep disorders, and cardiac arrhythmia is complex and linked through a lot of different mechanisms, essentially. There is strong data implicating sleep disordered breathing is inducing autonomic changes in the heart, which are going to potentially lead to these arrhythmias. However, repetitive episodes of hypoxia, meaning in sleep apnea, remember we talk about you can sleep or you can breathe, but you can't do both at the same time. And anybody who slept next to somebody with sleep apnea knows it's terrifying, because they are constantly breathing and then suffocating over and over again. That's what hypoxia is. The changes that are occurring when somebody's trying to breathe against an airway that is obstructed, those pressure changes, and the increase in inflammation, which we're going to get to in a minute, all could be independent risk factors for why these people seem to have more issues with cardiac arrhythmias. So Chris, your heart beats in a funny rhythm. Who cares? Not all drummers can be, Dave Grohl. Well, the problem with irregular rhythms is that that is a huge risk factor for stroke. In fact, many people who have particular arrhythmias are taking blood thinners to make sure that during that unusual and unpredictable heartbeat, you're not forming clots in the heart that could be shot out and create strokes from blockage. You shoot the little clot out of your heart, it travels through a vessel till it's too big to fit and it wedges there, and now you've got an ischemic stroke or an embolic stroke because of that blockage. So that is very important. And in fact, when you look at a lot of cardiologists in my area, it's amazing how many referrals we get because of cardiovascular issues and arrhythmias. Somebody feels kind of funny, they go see the cardiologist. Cardiologist says, oh, you're in atrial fibrillation. Take this blood thinner, go get a sleep study. The other thing is that when we do sleep studies, 50-year-old guy, his wife says he snores, comes in, has a sleep study. It's not uncommon to find arrhythmias during the night that nobody was aware of. So when you do a sleep study in the lab and even a home study, one of the things we're looking at is your EKG. Easier to see in an in-lab study a lot of times than a home sleep study, but we can see it, depending on if you've got leads hooked up to measure it. And there's often a conversation of, yeah, you've got some mild sleep apnea, but you had this very scary arrhythmia during the night several times. Were you aware of that? No. we even have protocols that if we see really scary arrhythmias, somebody's got to call us, as doctors in the middle of the night. Hey, Chris, your patient's going into a really scary arrhythmia at 7 beats of this, VTAC, whatever. And so this can be a really profoundly important discovery for people, and a very strong and meaningful potential solution for individuals who are going in and out of arrhythmia. So, controlling alcohol, if you have thyroid issues, there's things you can do to lower your risk of arrhythmia. Sleep's probably a very big one. I'm going to mention two more that I think are very important and clearly related to heart disease and cardiovascular risk. The first is glucose homeostasis. Are you managing blood sugar in your body properly? And this does not have to necessarily rise to the level of diabetes. Are you somebody who is moving in that direction? And I think a lot of doctors and myself tend to believe that we probably diagnose diabetes a little too late, that there are signs of problematic blood sugar metabolism or blood sugar control prior to that time. And there's a consistent association with lowered insulin sensitivity in individuals after they get little, small amounts of sleep. So sleep deprivation clearly impairs our insulin sensitivity. In fact, you can see evidence of this after just 4 to 5 days of insufficient sleep. Our insulin sensitivity can drop by as much as 35%. So there are meaningful long-term changes, but there's also meaningful short-term changes too. So if you're somebody who's consistently shortchanging your sleep, you're one of those people that we've talked about before. Hey, as long as I get 4 or 5 hours sleep, I'm fine. You may feel fine. Nobody feels a 20% insulin desensitization, but it's happening and it's having real metabolic consequence. So we want to be very careful and understand that if you're somebody who's kind of on that fence with your blood sugar, getting healthy, good quality sleep can really make a big difference. And inflammation. Inflammation is interesting, and it affects so much more than what we understand. Meaning that when we're not getting an adequate amount of sleep, inflammatory markers start to rise. And inflammation is a good thing. When you have an infection, when you've had an injury, there is an appropriate inflammatory response that should happen. However, when we're not getting enough sleep, we start to arbitrarily raise that inflammatory response, which can have devastating effects throughout our body, not just on our heart and cardiovascular system. It can have devastating effects on our brain. It can have devastating effects on our muscles. It can have issues, effects related to pain and arthritis and just all kinds of autoimmune types of issues. So it's very important that from a health perspective, we want to keep inflammation down. And one great way to do that is with sleep. And what's unfortunate is even after shorter periods of sleep restriction, we see that elevated inflammation. And there was a recent study in 2022 out of the Journal of Experimental Medicine that basically said this may be happening not only on a permanent basis in some people, but might be happening at the level of the genome, meaning you're actually changing genes based upon inadequate sleep. Now, this was a study of like 14 people. It's a pretty small study, but I think that is starting to become more and more accepted that we might be making permanent changes to our genetic makeup by the choices that we're making. So probably not chlorophyll level yet, but it's moving in that direction. So I think that we still probably can make up short periods of sleep debt. So maybe instead of thinking about getting 8 hours of sleep a night, let's think about getting 56 hours a week. So if Tuesday's not great, your flight's delayed, your boss made you do something extra, let's make sure we make it up in the next couple days and not let that sleep debt linger. So that's it. I do want to mention one more thing that's probably on the minds of a lot of people. We've talked about inadequate sleep as a risk factor for cardiovascular disease. We have talked about sleep disordered breathing and other sleep disorders, restless leg and potentially things like that. What about insomnia? So insomnia is interesting because when you actually look at relationships between insomnia and cardiovascular disease, they can be there. But a lot of times there's differentiations of insomnia with short sleep. So we've talked about the idea that insomnia and sleep deprivation are two different things. So when you have somebody who has insomnia, struggles to sleep, and that is associated with short sleep, so somebody who's going to bed at midnight, has trouble sleeping, wakes up a lot during the night, then they're up at 5 o'clock in the morning to go to work, that would be insomnia with short sleep, that there is relationships to it. And they can be kind of big. I mean, insomnia with short sleep, meaning getting less than 5 hours of sleep a night, you have like a 500% higher risk of having cardiovascular disease than if you don't. But what was interesting is in this 2009 study, it was published in Sleep, they said neither insomnia with a normal sleep duration, which is a lot of the people that we see, a lot, or of more than 6 hours, or individuals with short sleep duration who don't complain. Remember, we talked about the definition of insomnia, not sleeping the way you want to. That's part A. Part B is you care, you're upset, you've got a complaint. So basically what this study is saying is for people who are sleeping less than 6 hours but don't care, like they feel like, hey, I'm doing great, that relationship really didn't hold up, which is really confusing. So I still think that for most of what we're talking about here, we are talking about people who are restricting themselves to less sleep than they should be getting, and they're feeling the consequence of it. So again, if you're somebody who says, look, I'm lucky to get 1 hour of sleep at night, and I'm really upset about it, no sleeping pill works, et cetera, I don't think these things really apply to you, because I don't think that anybody out there is sleeping 1 hour at night. And we've talked about that in our insomnia issues episode, starting from our first one. So that's really it for the podcast. I do want to make one little quick addendum. One of the very first episodes that we talked about was on the relationship between sleep and menopause. In fact, it's episode number 3. I felt so badly about taking that out of my book, The Sleep Solution, that we made it episode number 3. There was a fantastic episode of The Daily recently about menopause and hormone replacement therapy. And we mentioned hormone replacement therapy very briefly in the podcast. I am not an expert on HRT. You do not want to be getting your HRT advice from me, but I am of a generation of doctors that were trained sort of feeling like HRT was a demon. It was a huge stroke risk. It was dangerous for women. And subsequently, we have sort of, I think, incorrect feelings about it. So one of the things that really struck me about that podcast, which I would really invite you to listen to after you listen to this one, especially if you're a woman struggling with menopause and sleep-related issues, is the changing in terms of the way we think about hormone replacement therapy in perimenopausal and menopausal women. So I'm not advocating for or against it. I'm just admitting massive ignorance and really suggest that women find expertise in that field, and hopefully the field of hormone replacement therapy and the fields of sleep can really come together. And these are two fields that share something in common, which is these things are not typically taught in school, in medical schools. I mean, most doctors will tell you they got very little, if any, training in sleep, and maybe even less training in menopause and hormone therapies for it. So doctors have lots to learn in lots of different areas, and those are two of them. So really appreciate tuning into the podcast. My name is Dr. W. Christopher Winter. You can find me Dr. Chris Winter Twitter, Dr. Chris Winter Instagram, Dr. Chris Winter TikTok. Find us on our YouTube channel. Buy my books, The Sleep Solution, Why Your Sleep's Broken, How to Fix It, as well as The Rested Child. Until next week's episode, sleep well.